Are you having numbness, tingling, or pain going down your legs? Maybe you've had a surgery where they were supposed to have fixed that, or maybe this is something new for you, like you've had a slip and fall or a car accident, or maybe this is just something that has gotten worse over time. Well, in this video, we're going to be going into another MRI breakdown to look into some of the symptoms of, symptoms going down your leg, why that could be there some reason. In this particular case, we're going to show you someone who's already had surgery to fix it that's still having this problem and see if we can help this person out to figure out where this those symptoms are coming from. If you don't know me, my name is Anthony Wade. I'm a physician assistant. In this capacity, I am your natural healing coach. And specifically, I'm your go to guy for MRI breakdowns. And that's exactly what we're going to be doing today. I have a fresh new MRI to show you guys. Unfortunately, it is just the picture, is not the whole um, MRI on a disc that we can pull up. That's what I like to really be able to get into all the different pictures that you'll find on your MRI to really get a good picture of what's going on so I can break that down to my clients. But, we're going to work with what we got. And what we got today is just one slice of the MRI, but it's a before and after picture. So it's pretty good. Um, the guy had surgery and you'll be able to see the before and after and find out what's going on with the guy today. So, again, I've been a physician assistant for many years, and I've been working with patients who've been in car accidents, slip and falls, sports injuries, you name it. They just come in. Sometimes pain just pops up out the blue. And one of the things that I love to do is to look at their MRIs and break down to my clients what's going on line by line, what's going on with their MRI. So let's get into today's breakdown. Let me pull up the picture. Let's see what the guy was talking about first. Let me look at my notes. Uh, let's see. Here we go. So this guy says that he went from an 8 millimeter herniation to a 5 millimeter herniation after surgery. And the problem is he's still having some numbness and tingling on the left side at the bottom of his foot. So he's trying to figure out, why is this still happening to me? He's supposed to have had this surgery that was supposed to have taken care of the problem, but he's still getting some of those symptoms. So let's pull up his image and let's take a look. All right, let's see. All right. Hopefully, you guys can see that. This is the before and after picture. It's labeled there, before and after. The one on the right is before surgery. The one on the left is after surgery. So, one of the first things that first looking at the before picture that should be very obvious is that big herniation down there at the bottom of the page, right above the before word, and that's basically a herniation where the disc is sticking out. I always try to explain it to people as you think about a burger where you squeeze the burger and the meat sticks out the bun. That is basically a herniation when it sticks out that far. Now, the level above it, a little bit of a herniation going on there. It's a little hard to see fully from just one slice view, but it looks like you can see the coloring of the disc is different from the four above. The coloring has gotten darker. That lets you know that some of the fluid has been lost from the disc, and the disc is starting to collapse down. You should be able to appreciate that. The disc should get bigger and bigger as you go down. But that is the one above the big herniations, the L45 disc, and that's collapsed down a little bit, along with the L5S1 disc, which also has the herniation in there. So, um, again, that's the surgery. On the left, you see after the surgery, the same person. And as you can see, the L5 disc is much smaller. They basically went in there and taking care of that problem. So let me explain first what is the surgery that this person has. And hold on for a second and pull my picture back up. Basically, he had a microdiscectomy. What does that mean? A microdiscectomy means that they went in, it's a surgery, but they made a really small incision in the person's back. You laying flat on the table. They cut a little small incision and they start putting some, think of it as straws down through the hole, and they start putting a bigger one and bigger one and bigger one over the top of each of the straws. And what that does is it spreads out the skin and makes a bigger hole, but it's stretching the skin. It's not cutting, you're not making a big incision. Way back in the days when they did spine surgery, they would make a huge incision and fillet the person open. Now you can do it with small, minimally invasive, as they say, cut, where they just make that hole bigger by putting those tubes down there that get bigger and bigger. So once you do that, you have a clear view all the way down to the spine, and you can actually see the disc. You may have to remove a little bit of bone of the lamina there, but you can see the disc and you can see the spinal cord. And basically, they take a pair of like scissors, but they're not scissors, they're little grabbers, but they're long. And you got a handle on the other side and the little grabbers, at the opposite side, and they stick it all the way down in there, and they use the little grabbers to pull out the disc material. At least that's one way that we used to do it when I did spine surgery many years ago. And they basically remove that disc portion that's sticking out. Think again of the burger. You go in there and you just pull off the little pieces of meat that's sticking out. That's basically it, microdiscectomy. Once that's all the way done, pull the tubes out, sew the person back up. That was my job, and we're all done. And that's what happened. Unfortunately, this person was having symptoms going down his arm. Now, let me just put it out there that I've never talked to this person before, so I don't have the person's full story. Plus, I didn't say the disclaimer. This is just for informational purposes only. Again, I've never talked to the person before, so I don't know his full story and all the details. I just have what he posted, and I'm just trying to answer his question. So, um, again, that person was having symptoms going down his leg. That's one of the reasons why he had the surgery. He probably had some pain along with that. And let me first say that sometimes you can have those symptoms going down your leg and have a normal MRI. That's a totally different subject. But with this particular person, when they did the MRI, you can see the big herniation sticking out there. That herniation is probably pressing on the structures in the area. Unfortunately, we couldn't really see that on the particular slice of the MRI that we were looking at, but it was, likely pressing on other structures. That's why the reasons why they did the surgery. But the thing is, so once they do the surgery, once they shave off that part, there's a couple of things. Number one, to answer his question, where's the numbness coming from? You have your spinal cord that runs up and down your spine. It has branches that come off. Those branches in the lower back come off and go all the way down the legs. And for different reasons, you can have even just soft tissue swelling pressing on those nerves. But in this particular case, I assume that it was the disc material that was pressing on the nerve. So the problem, which I don't know the answers to this, but one of the problems is if that nerve has been irritated for too long, there is a point of no return. If you get too much irritation on the nerve, you can permanently damage that nerve to where the surgeon can go in and do a perfect surgery. And unfortunately, you've gone past the point of no return and those symptoms are still there. It's become chronic. Chronic pain is pain that's been there anywhere from 3 to 6 months. So with that said, if you have these type of symptoms, you want to get it checked out with your trusted provider and make sure that this isn't something that needs to be operated on. There's a lot of steps before that. We'll get into that in a second, but this is something you don't want to ignore and wait too long, because even if they later on, if you waited too long and you do a perfect surgery, you could still have problems. So that's one thing that could be the case with him. The other thing is, nerves take a long time to heal. They don't just, take them sometimes, sometimes if it's acute, it's something that's just happened and you got this big herniation sticking up against there and you didn't wait too long and you got to it soon enough. You remove the pressure off the nerve and things can get better right away just because of that. The analogy I like to use is like a rock in your shoe. If you got a big rock in your shoe, take the rock out, things should go back to normal. So, but nerves can take a while to heal. Sometimes it's automatic and right away, and symptoms are relieved. Other times, they can heal. They just take a long time to heal. I forgot the actual rate that it heals, but it takes a while. So, you can have symptoms can as it starts to heal and gets better, your symptoms will go like further up the foot, closer and closer towards the spine as it heals. But that could be another reason why he's still having problems with the nerve sensation still there in his foot. These things you got to give time. So after surgery, if it doesn't, take it right away, you got to give it some time and some healing. Another reason is inflammation around the area. This area has been cut open, and so there's going to be some inflammation going on. Extra fluid and all that stuff in the area could still be pressing on that nerve. Once that inflammation has gone down, the symptoms could, start getting better. So, to answer that question, that's a third reason why, it might be just inflammation there. I said it could be the nerve just needs some time to heal, or it could be that it took too long to get to the surgery and permanent damage has settled in. I'll give you a story about my own self. Recently, about a little over a year ago, I had a bicep tendon rupture. That's your bicep tendon connects to the bone in your arm here, and it ruptured. I'm not going to give you the whole story of that, but it got pulled, off the bone, and I had to have surgery. They basically went in, cut a opening there so it can get down to the tendon and reattach it to the bone. And but in order to do so, there's a nerve that runs through here, a little ulnar nerve, and they had to move that nerve out the way. That nerve wasn't part of the injury, but it was in the way. So it had to be moved out the way in order to get down to the spot they needed. Well, again, nerves don't like to be irritated or messed with. They don't like any pressure on it or anything. And after the surgery, all of my hand was numb. It was because that nerve innervates all of my hand. And, being who I am, I kind of assumed what the problem was, but, my surgeon explained what exactly happened because I didn't know about the nerve being moved or any of that stuff. So he explained it to me, let me know that it was going to get better and it's gonna again go down the arm as it gets better. Now he did warn me that sometimes you'll get some patches of sensation in your arm where it's numb and you don't get that back. Thank God that didn't happen. And sure enough, as things progressed and got better, as I went through rehab and all my uh, s- exercises and all that stuff, the symptoms started to get better and they started going down my arm and I got the sensation back, no patches, none of that stuff. But till this day, if I just stroke my hand here, you could do it with one finger, I can feel it's like playing a guitar string. I could feel stuff shooting down my arm just from me stroking it. um and that's gotten better because it used to be when I was trying to do push-ups and got to muscle failure, my arm would start going numb down to my hand and all that. That's cleared up, but again, I still have that sensations that I can play around with it. I think it's kind of cool. It's kind of neat. But anyway, so any of that stuff can be happening. I feel for this guy, but there is hope. I believe that the symptoms will get better and he will recover, but that is, some of the reasons why you can still have some numbness, some tingling and pain after surgery. The surgery looks pretty good. It looks like they removed the bulk of it. and I believe that the guy will probably have a full recovery, but I don't have all the information, but those are my wishes for the guy to get better. So, what are the things that you can do about it? So, I'm a big proponent of stretching. As when you do a lot of stretching, it can help get the inflammation out of the area. It can help rebuild. First, you have to rehab the area because you had surgery on it, so you got to rebuild some of those muscles, ligaments, and all that stuff. Not really ligaments, but you got to repair the area, and you do that with a lot of stretching initially, and then start rebuilding the muscle and rebuilding the strength in the area. So that is one of the things that he can do, putting cold packs on there and stuff like that. That helps with the swelling and whatnot. And after a while, you can start putting heat on it. All these things can help, but you got to get up, you got to move, you got to stretch, you got to get into some type of exercise routine with physical therapy and all that when it comes to recovery from your surgery. So that's something that he could talk to his provider about. But there's a lot of different stretches and exercises that people are supposed to do after surgery that he can start doing, and prayerfully that will help out his symptom. So that's pretty much it. Again, um, after your surgery, you can have these symptoms. They should get better over time. If you're having some symptoms like that going down your legs, and if you've gotten a new MRI and you're having, some confusion, you don't understand the wording that's in there, all the medical mumbo jumbo, and you want some clarity and some understanding, I do offer a service where I go one on one with a person over like a Zoom call. I'll have you send me your images. I'll load them up in my computer. We'll pull them up together and go over the MRI reports line by line to give you a better understanding of what's going on with your MRI. So you can have that information to take back to your provider. We'll talk about all the different treatment options that are out there, including natural treatments and other middle of the road stuff like injections and all that stuff. But we'll talk about all those things so you'll be better equipped to go to your provider with some more questions and information that you can share with your provider to figure out the next best steps for you so you can recover faster. So again, I will put some link somewhere in the information under this video for you to reach out to me. And I hope that this has been some type of help for you. I love doing MRI breakdowns, and this has been a really good one. We got a before and after picture. We don't always get that, but this has been a good one. And again, I pray that this has been some type of help for you, and you take the information and use it to better yourself and to get back on track, recover fast, and get back to your lifestyle. So, again, my name is Anthony Wade. It's been a pleasure, and I will see you next time.